Yes, I think for the first time we have this very nicely described, and in some ways, you know, maybe people will say, well, it's intuitive, but on the other hand, we now have sound scientific evidence that young women in our region are at risk of acquiring HIV from men who are not very much older than themselves, but somewhat older than themselves. That they then settle down into more stable relationships. It's at that time that they transmit virus to young men. And these young men in turn become slightly older men who infect younger women. And so it really is a vicious cycle that requires us to come in a very strategic way in each one of those populations to say, where are these men? Have we got them in our services? Are they tested and are they virally suppressed? Because we know if they're virally suppressed, they won't transmit the virus, even if they're having sex with younger women. Where are the young women? What are we doing to empower them, to give them prevention options so that even if they have sex with older men, which we will discourage where we can, but should they do this, they will still be protected. And when they have relationships in a discordant way where they may be infected but a young man coming into the relationship is not yet, we can come to that discordant relationship if people undergo couples counseling and testing to actually say, what can we do within that?
What are the alternatives for them to be safe in the process?
And I'm so excited as a HIV researcher clinician that we do now have choices and alternatives.
And maybe that's what I should basically delve into, the vaccine research and your co-lead, basically the HVTN, which is the HIV Vaccine Trials Network 702, you know, that is being run in South Africa. You know, tell us a little bit about that and how, you know, the research you're running is bringing about solutions and, you know, a widespread of options for people to explore into.
So Tony, I've already mentioned that you know, we actually do have a good set of tools in our back pocket, and there's no doubt that our governments, our policymakers should be collecting around how do we deploy those tools in an effective way. But there is no doubt that a vaccine is going to be the ultimate way to control the epidemic in our region. That is applied to polio, it's applied to smallpox. We won't get complete elimination of an infection such as HIV without a efficient vaccine. So that research is ongoing. And again, we're at an exciting time in our lives where there are a number of vaccine trials underway, and we should be seeing the results of those within a couple of years, which will really give us a sense of how viable is well, let me say, I have no doubt we will ultimately find a vaccine. The question just is how soon. And I think the results of the trials that are currently in the field will give us a sense of how close we are. We should hear results of those within the next 1 to 2 years. So again, an exciting time.